What is the cause of your knee arthritis? There's many different causes to knee arthritis, but likely there's one that's most important for you to be working on. Let's discuss which are the causes of knee arthritis and which is most important for you to focus on so that you can help your knee arthritis and avoid a knee replacement surgery. So the top 6 causes of knee arthritis, as reported in research and any healthcare professional will talk about to you. 1 is going to be age, your genetics. 3 is going to be old injuries. 4 is going to be your weight, if you're overweight. 5 is going to be diet. And then 6 is repetitive stress. But let's talk about what you can control, because the first 3 you can't do anything about. You can't change your age. You're only going to get older. You can't change your genetics. You are the way you are. That includes your body size, your body shape, like your frame, if your knees kind of bend in a little bit or bend out, if you have a history of knee arthritis in your family, and you can't change the past. Your old injuries are there. It's okay. You're going to have to live with them and figure out how to work with them. But the bottom 3, you can absolutely affect. You can change your weight, you can change the way you eat, and you can change repetitive stress. So let's break these down. If we're talking about weight specifically, just look over here for a second. We know by research, there's a study done on the lifetime risk of getting knee arthritis. And what we found was that there is a little over 9% chance of you getting knee arthritis even if you're normal weight. And they defined your weight as your BMI. They went with BMI. Body mass index. I'll talk more about that in a second. But it jumps to 25%, a little under 25% if you're obese as defined by BMI. Let me show you what I mean here. This is a body mass index chart. And if we look at it, let me go off myself. I have 2 examples to talk to you about. So the first one is going to be just me, myself. I am 6'2", so I'm gonna show you my BMI here, and I weigh about 235 pounds. So there's 6'2" right there, and the weight is right here in pounds. So I'm right on the line between 230 and 240. So if I just follow that line down, my BMI is probably about 30.5. And the way the colors work here, this red means you're severely obese, the orange is obese, yellow is overweight, the green is your best weight, your optimal weight, and then the blue are underweight and severely underweight. So I am on the line between being overweight and obese. What that means is that according to the research, I have a 25% chance of getting knee arthritis just because I'm almost obese. But you have to factor in muscle here, because this is not considered when it comes to BMI, using the body mass index. Whenever talking about BMI, they're only looking at your total weight, not your body fat percentage, and they're putting that together with your height to determine what your BMI is. And BMI is used for general populations to measure, the health based on weight on general populations. So you have to factor that in. But let me give you another example. I had a patient recently who was 5'5", so she's right here, and she weighed 160 pounds. That means that she was at 27 right here, and she was technically in the yellow zone, which means she's overweight. She was diagnosed with knee arthritis. She had x-rays. They showed her at KL grade 3, which means she had grade 3 severity knee arthritis. She had decreased joint space, pretty much getting bone on bone. The doctor then told her, you need to lose weight. And she figured out her BMI, and she realized, I need to lose about 20 pounds to get into the normal zone. So she was at 27 right here, and to get down to 23, that means she'd have to get from 160 to 140. Now, I'm not saying don't lose weight, but what I'm saying is, going back to obese, you need to be in this orange zone. So she actually has 20 more pounds she can gain before she's technically obese. Sure, you get increasing chances of getting knee arthritis the heavier you are, but is that the main factor to focus on? That's the whole point of this video right here, is what should you spend more time, effort, energy doing? Trying to lose weight, or maybe there's other things. So let's investigate the other three things that we have, two things we have, let's talk about here. I'm not an expert when it comes to diet. I am not a nutritionist. I speak about mechanical aspects of knee arthritis and other arthritis related problems. But when it comes to osteoarthritis, let's just talk about the meaning of the word. It's Latin for, it's three parts. Osteo means bone. Arth, osteoarth means joint, so bone and joint. And itis means inflammation. So when we talk about diet, it's pretty well accepted that there's certain foods that are inflammatory, more inflammatory, and there's others that are less inflammatory. And my best advice, very general here, is to stick to foods that are less processed, because they usually will have much less added things to them, and there's just less changes to the food, and so your body's going to be better able to process them on the inside of your own body. If you look at the picture here, on the left here, number one is no or minimal processing. So all they do to the food here is clean it, grind it, refrigerate it. Maybe it's pasteurized, fermented, frozen, or packaged. And examples would be just fruits and vegetables, all the stuff right here. When you look at number two here, there's some processing that has to happen to make these things. We're talking about oils, seeds, flour, and pasta. They have to be pressed, refined, grinded, or milled. And then you get more process as you go along. Number three here is your legitimate processed foods, because things have now been added to the original food, like salt, sugars, and fats. And they do that in order to better preserve them, because they're going to can it. You're talking about canned fruits and vegetables, canned fish, bread, cheeses, those kinds of things. Now, when you get to the last section over here, this is your ultra processed foods, which means there's artificial colors added, preservatives added, and then it's usually packaged to last a long time on a shelf. It's the type of things that you find in the middle of the grocery store, the things that don't expire for months or even years in some cases. And it's going to be your cookies, your juices, cereals, and other foods like that. The general idea with modifying your diet so that you have less inflammation in your body is to stick to eating foods in category 1 as much as possible. Again, you have to figure this out for yourself. There's going to be allergies that individuals have. There's going to be certain foods that some people are just more reactive to than others. So the key takeaway in this section with diet is have less processed foods so that you can decrease your inflammation. All right, let's talk about the third thing that you have the most control over, and that's going to be repetitive stress. Now, repetitive stress, I kind of have to rant just a little bit here because it's so vague. What is repetitive stress? I get patients all the time that are told that their knee arthritis is related to repetitive stress. And when they consider what in their life is repetitively stressful, the first thing they talk about is, well, I walk a lot because that's the kind of person I am. I'm just a busy bee. I'm always walking around in my house doing things, or my job is making me go up and down stairs, or I have stairs at home that I'm having to go up and down all the time. It's usually associated with walking, maybe exercising if you're a gym goer or you like to be very active with exercise. It could also be that you have small children to take care of, whether they're your children or your grandchildren, and you're busy with them. That's repetitive stress. And it's so frustrating because some of these things you just can't get around. I mean, how else are you going to exercise without involving some form of walking? How else are you going to take care of family members without having to be after them? Or just keep your house clean and tidy, or be able to go work? So repetitive stress, in my opinion, is just not a good label for this. What I think instead is you have to walk. That's okay, but let's figure out a way to do it where it helps you instead of hurts you. You have to work, potentially, if that's your situation. How can we make it be productive for you, for your knee health, instead of destructive for your knee health? So there's something that I call a muscle imbalance, and let's discuss it over here. What you want to think about is the structure of your legs. So I'm going to give you a crude drawing here of a thigh bone, and you're looking at the side view, and then here's the kneecap right there, and then here's the shin bone right below the thigh bone, and it goes down and it makes your foot. I'll just draw a basic foot there. Now the muscles that connect around your knee and make the knee work the most directly anyways, the most direct muscles are going to be your quad muscles right here, and they have a tendon that goes down and attaches to the front of the shin bone. And then you have your hamstring muscles that come on and attach on the sides of the shin bone. And that makes up your thigh muscles. Now, the line of pull for these muscles is going to be in this direction. They pull up and down. So because of that, they're pulling your shin bone up into your thigh bone, and it makes the kneecap go this way into your shin bone, really on the end of this bone. It goes onto the round part. I'll leave it like that for now. So what you have to think about here is if you get stronger in your quad muscles right here, which is what most people do to try to fix their knee arthritis, then you're going to be adding more force on that muscle, and potentially it's going to be getting thicker as well. That's going to increase the forces at the knee joint. So if you look at the model here, this is your quad tendon, so the quad muscles would be right up here, and then here's the ligament that attaches the kneecap to the shin bone. And when these muscles get real strong, it pulls the kneecap against the thigh bone right there, and there's cartilage on both the kneecap and the thigh bone where they touch. And so as the knee bends, it sits in that groove. But if you compress it too much, it starts to irritate the joint and cause inflammation right behind the kneecap and right here. And then because this is attached to the shin bone, it's pulling the shin bone up into the thigh bone, and that's also squashing the cartilage down in here on the bottom of the thigh bone. This simulates it right here. It looks like it's all worn out. That's, I think, an extreme example in my opinion, but most people that can bend their knee quite a bit don't have that much. And so when you irritate that knee joint, it's because of these quad muscles acting too much on the knee joint. So there's too much compression happening right here and right here in the knee joint. And it's because of the muscle imbalance and those quads being too strong. And if you have too much compression and then you're walking a lot, or even just walking a little, you can get that repetitive stress happen. But the question you need to ask to help the situation is, how can we decrease the force of the quads, the thigh muscles, on the knee joint so that we can reduce the compression so that you can walk without excessive repetitive stress going through your knee joints? Well, let's look up higher in the joint. If we go up a little bit higher right here, you have the ball and socket joint that makes up the hip. I'll just draw the bone kind of like that. And on the back of the hip joint, you have this muscle out here, a group of muscles called the glute muscles. The glute muscles and the thigh muscles, especially the quads, have a relationship with each other, where if the glute muscle isn't doing its job, if it's not that strong, then what happens is the quad muscle likes to compensate. It starts to work more, so it'll get stronger. So in order to get the quad muscle to not be so active, what we have to do is start using that glute muscle even more, because then you get better stability up at the hip, and that means you'll get better use of your knee joint if you have better glute strength, and it starts to decrease the excessive forces that are going through your quads, which decreases the excessive compression down at the knee joint. This is going to save your knee joints and normalize the pressure, because what we want is normal pressure in the knee joint as much as possible. If we can get stronger glutes that means you have normal pressure in the joint. And that's what we need. It's my strong opinion that the idea of repetitive stress is too vague, and we need to instead be calling it a muscle imbalance, because this gives us a practical place to start to work. Because if you just talk about repetitive stress, it's much too vague. It could be a bunch of different things in your life, and you're left on your own to figure out which one to cut out, which one to modify. But if you figure out that you have a muscle imbalance, especially because your glutes are weak and it's causing your quads to be over dominant, leading to excessive compression in the knee joint, then you have a chance at figuring out how to get your glutes stronger to normalize the knee pressure. Looking at it this way, it's one more picture to look at. For most people, especially if your BMI isn't that high, maybe you're a little overweight, but you're not full on obese, and maybe your diet isn't that bad. You actually probably eat a lot of healthy foods that aren't high in inflammation factors. If you think of your knee arthritis in a pie chart, so we'll call this your knee arthritis problem. Arthritis, I'll write it all the way out for you. What I tend to find, and this is just my rough estimate, is for most people, 75%, use a different color here, is this side here, 25 here. Well, I'm thinking of it wrong. We'll say 12.5%, 12.5% is going to be weight. This one's diet. And then this one right here, muscle imbalance. So think of this. If your knee arthritis problem is 75% a muscle imbalance, are you spending too much time on weight, trying to lose weight? If you just have 10, 20, 30 pounds to lose and you have leeway, and maybe you actually have a lot of muscle and it's throwing your obesity into the higher range because you're using BMI, you have to just think about those factors. Maybe your diet isn't that bad. You tend to eat pretty well. You don't think you have a lot of inflammatory foods in your refrigerator. You can shift the percentages here depending on your specific situation, but I'm willing to bet that you probably have a massive muscle imbalance. And it's absurdly clear if you can't squeeze your glutes on command, if you don't have conscious control over your glutes, and if you know that your glutes are just very weak, you can't even remember the last time that you felt your glutes working or even get sore or active at all, then maybe it's more like 90-10 or 99 and then 1%. And if you spend more time and effort working on the bigger chunk of the problem, you're going to get much better results. If you want the next steps on fixing your muscle imbalance to help knee arthritis heal so that you can avoid a knee replacement surgery, check out this video. It's no BS advice to fix your knee arthritis in 90 days.